Now, to vaccines and the pandemic, the Major General in charge of Canada's vaccine rollout confirmed today no doses of the Pfizer-BioNTech vaccine will be delivered to Canada next week. Pfizer has said the delay is necessary because it's retooling its manufacturing facility in Belgium so it can expand production there. Ontario's Premier Doug Ford says he doesn't buy that.
How is all these other countries around the world getting them and Canada isn't getting them? Said down in the U.S. as well, down in Kalamazoo. I'll drive down there myself and we'll pick them up if we have to. I'm going to be on them like an 800-pound gorilla until they come up and deliver vaccines.
On top of the vaccine delay, concerns are growing about how fast highly contagious variants of COVID-19 are now spreading in Canada. Preliminary results reveal a variant has reached a care home in Barrie, Ontario, where at least 25 residents have died. As Eric Sorensen reports, the variants are so much more transmissible and detecting them is more complex than a simple COVID-19 test.
6 cases of a COVID variant in this Barrie, Ontario long-term care home is just the kind of spike in transmission that health officials fear is just the beginning. They're waiting for a second round of tests, but the outbreak is serious because COVID variants are proving to be more contagious.
The spread was so quick and so serious that there was a concern there that it might be a mutant spread, and which it is.
Canada is ahead of most countries in the search for the COVID variant. The Canadian COVID-19 Genomics Network is looking for the missing gene in samples from different parts of the country.
So we are looking at different groups, also geographical regions where there's a significant and rapid spike or increasing number of cases.
It's a search and destroy. We want to find these in our communities and we want to stop those trends of transmission so it doesn't spread in our community.
There are signs that recent restrictions in Ontario to limit contact with others is working. One positive trend, the curve of daily cases in Ontario peaked at an average over 3,500 10 days ago and has now fallen to 2,751, a more than 20% drop. But other forces, like the COVID variant, could re-inflate that curve.
Yes, lockdown is slowing transmission. But where transmission is happening, the risk that it can increase even faster is now higher because of the presence of these new hyper-transmissible variants.
Regular COVID checks do not identify the variant. Positive results require added genomic testing to get a clearer picture of how much mutated virus there is. All of one day's positive tests in Ontario have just been scanned.
There are roughly in Ontario 2,600 positive cases. Public Health Ontario will be doing this S-gene dropout test for the UK variant on all of them. And we will actually hopefully sequence all of those.
American health officials expect the COVID variant will be the dominant virus in the U.S. by March. Health officials here say it's a critical time for Canadians to continue to limit their social contacts to keep numbers down until enough vaccines arrive. Eric Sorensen, Global News, Toronto.